You know, when you open up your medicine cabinet, you see all the usual stuff. Pills for headaches, cough syrup, bandages. But lurking among those everyday items, there could be a hidden danger. Today, we're going to talk about how some of the most common medications we all use can pose a really serious risk to one of our most vital organs. So let me start by asking you a question. Just think about this for a second. If your kidneys fail, you can go on dialysis. If your heart gives you trouble, there are machines that can help keep you going. But there's one organ in your body that, if it fails, has absolutely no mechanical substitute. Any ideas what it is? You guessed it, it's the liver. Your liver is basically the master filter for your entire body. It processes everything you take in, food, drinks, and medications. Its job is to clear out all the toxins. It is an absolutely essential and completely irreplaceable powerhouse. To give you a sense of just how big this issue is, get this. In the US alone, there are over 2,000 cases of acute liver failure every single year. And here's the kicker. About half of those are caused by medications or supplements. Half. Okay, so how on earth would you even know if your liver is in trouble? Well, let's dive into some of the early warning signs you can actually look out for. The good thing is, your body does try to send you signals. So you want to keep an eye out for things like really dark urine, feeling incredibly tired for no reason, or pain in your stomach. And of course, one of the classic signs is jaundice. That's when your skin or the whites of your eyes start to turn yellow. These are definitely not symptoms you want to just brush off. Now, here's what makes this whole thing so tricky. The timeline for when these symptoms pop up, it's all over the place. You could start feeling something as early as 5 days after starting a new drug, or it could take up to 3 months before anything seems wrong. That huge range is exactly why you have to stay aware. All right, let's get to the main event, the medication list. We are counting down the 10 drugs that are most often linked to liver risk. And I promise you, number 1 is going to be a shocker. Kicking off our list at number 10 is diclofenac. If you've ever dealt with some serious pain or inflammation, this name might ring a bell. So most anti-inflammatory drugs carry some level of risk, but diclofenac? It has the highest risk of liver injury in its entire category. And just like we mentioned, the damage might not even show up for weeks or sometimes even months after you've started taking it. Coming in hot at number 9 is a combo I'm sure you've heard of, amoxicillin with clavulanate. It is one of the most prescribed antibiotics out there. And for good reason. It's fantastic for clearing up all sorts of infections, from your sinuses to a UTI. But, and this is a big but, it has a pretty serious dark side. It's been directly tied to hundreds of cases of acute liver injury. It's a powerful medicine, for sure, but one that comes with a very real risk. Okay, let's quickly run through the next few. At number 8, we have a medication for heart rhythm problems. Number 7 is for treating gout. And at number 6, we have a whole class of drugs, anticonvulsants, used for seizure control. And the countdown continues. At 5 and 4, we've got drugs for arthritis and nasty fungal infections. Then, coming in at number 3, is a high blood pressure medication that's even considered safe during pregnancy, but it still carries a risk to the liver. And our runner-up, taking the number 2 spot, isn't just one drug, it's a whole family of them, antipsychotics. These are powerful drugs used for serious conditions like psychosis or depression that just isn't getting better with other treatments. So how exactly do these drugs hurt the liver? Well, it's a process with a fancy name, drug-induced cholestasis. But what it really means is pretty simple. Drugs like risperidone can basically clog up the plumbing, stopping the flow of bile from your liver. When that bile gets backed up, it builds up and can cause some really serious damage. And that brings us to the number 1 spot, the single biggest cause of liver failure from medication. And I'll tell you what, it's a painkiller so common, you almost definitely have it in your house right now. Any last-minute guesses? The number 1 culprit is paracetamol. You might know it as acetaminophen in the US. That's right. The go-to over-the-counter pill for headaches, aches, and fevers is the leading cause of drug-induced liver damage. I want you to just let this sink in for a second. This is a direct quote from our source material. More than 1/3 of all cases of liver failure caused by medication are because of paracetamol. That is an absolutely staggering statistic for a drug we think of as so harmless. Okay, now this next part is maybe the most important thing to understand. The danger is not the drug itself, it's the dose. When you take it as directed, paracetamol is completely safe. It's so safe, we give it to babies. The problem, the toxicity, the liver damage, it all comes from one thing, taking more than you're supposed to. So after hearing all that, you're probably wondering, what am I supposed to do now? Well, how can we use these medications safely and actually protect our liver? Let's talk about the practical steps you can take. Here's some good news. For a paracetamol overdose, there is an antidote. It's a drug called acetylcysteine. It works really well to protect the liver from damage, but, and here's the catch, you have to get it in an emergency room. It's not something you can just take at home. So the most important takeaway here is this. If you even suspect an overdose has happened for you or someone else, do not wait around for symptoms to show up. Get to an emergency room immediately and tell the doctors exactly what happened. Acting fast can literally be the difference between a full recovery and permanent damage. And now for a really, really crucial warning, and this comes directly from our source. If your doctor has prescribed any of the medications on this list for you, please do not stop taking them on your own. For many people, the benefits of these drugs are life-saving and far outweigh the risks. Suddenly stopping can be incredibly dangerous. Always, always talk to your doctor first. So we'll leave you with this final, critical question. Paracetamol, or acetaminophen, is an ingredient in hundreds of different products. It's in cold and flu medicine, pain relievers, sleep aids, you name it. So are you actually checking the active ingredients in everything you take to make sure you're not accidentally taking too much? It's such a simple habit, but it's one that could literally save your liver.